Okay, welcome to the KED station. This should be interesting because we typically do not put a KED on an unresponsive patient because of their, at that point their injuries are critical, and we know that we would be transporting immediately using urgent moves and we would never put them in a KED, so it's not really designed to put on somebody unresponsive, so it's going to be interesting here to see how our mannequin does. By the way, we still need a name for our new mannequin. This is, I don't know, I guess maybe we could call him Roni or something. He was purchased for COVID so that we can practice our skills on a mannequin instead of other people. So I guess we can call him Roni here, or Rona for the female version. But he or she is not going to cooperate very well probably for this station, so this should be interesting. But I'm going to go ahead and get started here. So I have my PPE on. I'm going to have my partner hold C-spine, so they're going to hold Roni's head in a neutral inline position as I apply the splint. Just like with backboard, this person's going to be imaginary, so they're going to be here holding C-spine. I'm going to check CSMs in all four extremities, so I'm going to feel for a pulse. I'm going to ask which finger am I touching, and please squeeze my hand. I'll do that with all four extremities. And I'm now ready to apply my C-collar. I will start by measuring my C-collar. Looks like we're going to need tall. Okay, apply this to the chin first. And then bring the back of my C-collar around, Velcroed as tight as I can. Okay. So now I'm ready to actually put the splint behind the patient. So this is the KED vest. Okay. You notice that this right side has a lot of buckles. So if I try to come in from over here, they're all going to get tangled up. So I'll start from this side. I'm going to, normally I would ask my patient to help me with this. So I'm going to put my hand on their chest. I'm going to ask them to bend at the hips, keeping their back straight. And we're going to move forward just a few inches so we can slide the KED between them and the seat. So we're going to lean forward on 3, bending at the hips, keeping the back straight. 1, 2, 3. Okay. At that point, we will now slide the KED in behind our patient.
I think that's because...
Okay, and we're going to lean back in the chair again on 3. 1, 2, 3. Keeping that back straight. Okay. Looks like this is going to work okay with the mannequin. So we'll now put this under the arms. Okay, at this point we kind of want to look at the height of our splint. I can see the top of the head is just a little bit past the splint, and these pieces of flaps aren't quite up in the armpits. So I'm just going to shimmy this upwards just a little bit so that it's more aligned with the top of the head. Okay, we're now ready to start tightening the straps, or attaching the straps. Doesn't really matter which order you go in. I usually start at the top. And for now I'm just going to get this, get a bunch of the slack out of this, but I'm not really going to tighten it down or anything. Just getting the slack out. Now attach the yellow one. Just get some of the slack out. And now we'll go with the red. And just get some of the slack out. Notice that even when I'm just pulling the slack out, I am holding the buckle with my right hand so that it's not jostling the patient too much. Okay, now we're ready to start tightening the straps. Just like with backboard, as we tighten these straps over the chest, I want my patient to take a deep breath so that I don't impede their breathing with the tightness of the straps. So please take a deep breath in and hold it. Okay, to tighten this, I'm going to push with my left hand as I pull with my right so that I'm not moving my patient basically at all. Okay, you can relax. Exhale. Okay. We go ahead and get in position, so I'm going to push with my left hand and pull with my right. All right, go ahead and take a deep breath for me and hold it in. Okay. Get that as tight as I can. Okay, you can relax, breathe normally. As I tighten the red strap, I don't have to worry about their breathing, so it's down on the stomach, the lower part of the abdomen. Okay, but again, I'm going to push that through as I pull it. Okay. Those all look pretty good and tight. I can ask my patient, can you breathe okay, to make sure they're able to still breathe. Other than that, I'm good to go. Now we have 2 leg straps. So the leg straps a lot of times will be kind of back here behind the patient. You might need to kind of fish those out. Looks like I've got one of them available here. So at this point, I'm now going to shimmy this under the patient's leg. And we're going to seesaw this up into the groin as far as we can get it to make this patient really secure. So I'll seesaw that up into the groin. We're going to come up over the top and attach the strap right here. And again, we'll tighten that down by either holding the buckle or pushing the strap to feed it through. Get that as tight as we can. We have one on the other side. So it looks like it's a little more tangled. Get that untangled. Okay, let's shimmy this under the leg. And I'm going to seesaw it back and forth. Get it to slide up under the leg, all the way up into the groin. To get a little bit personal here with our patients. Okay, once I get that up as far as I can, one extra step I like to take is to actually pull this. So if there's any slack behind the patient in the seat, I'll pull that slack out. And I can now buckle this into the buckle on the other side. And again, I'm going to tighten that down. Try to get all the twists out of it. Okay. And then I will push that through as I tighten it. Now sometimes, depending on the size and shape of your person, after you tighten down these leg straps, we'll need to go back up and tighten these. So go back up and check your straps again. It does seem like these have loosened up a little bit. So I will now go back up to my torso straps and retighten those. So take a deep breath for me and hold it in. I'm going to push, pull as tight as I can. Push, pull as tight as I can. Okay, you can relax and breathe normally. That one. Okay. Just like with backboard, we now have the body secured. We're now ready to secure the head. So for the head, my mannequin here, Roni, doesn't have much of a posture. So probably just one fold of this pad will work. Most people are going to be sitting upright and will end up doubling the pad over and sticking it in behind their head. For him, I'm just going to go once. Okay. And then to secure the rest of the head, I have these Velcro straps, which usually don't stick, so you may need to switch and use tape. But just like with the backboard, I'm going to start high, up by his forehead, and come down around his chin, and then hook up high on the side of the Velcro. Okay, and then on the other one, I'm going to start low. And I'm going to come up high across the forehead, and I'm going to stick it down there low. So it kind of makes this X shape so it'll hold better without sliding off. At this point, my partner's going to continue to hold C-spine. I'm going to recheck CSMs on all four extremities. We're going to transfer our patient from the KED onto a backboard, secure the patient and the KED to the backboard, recheck CSMs one last time, and then we'll be ready to transport. I think that's it.